Castro, but we'll go next to Senator Hassan.
Thanks, Senator Warner. And I won't take long because really most of my questions have been answered. But first of all, to Susan Stearns, I just want a huge thank you. We both share children named Ben. And our Bens have both had similar challenges. And so I'm very grateful to you for your work. But I also am very grateful to you for talking about the difference that the ACA has made, Medicaid expansion and the ACA for people who are seeking addiction treatment or mental health treatment. And just, to amplify the point that Susan made, one of my constituents, Sherry from Lebanon, New Hampshire, was battling addiction, other mental health challenges. They're often co-occurring, as I think probably everybody knows. And her story about getting help through the Medicaid expansion program was a story about getting treatment, but then getting into recovery and her ability to return to work and then to go on to private health insurance, which, of course, through her employer, which, of course, is one of the goals we all have, is for people to be able to get better and get to work. And as Susan indicated, that is a story I have heard over and over again from people who have gotten treatment for substance abuse or mental health or any other chronic health condition on Medicaid expansion and been able to return to the workforce. And I think it is easy, as we're having these discussions, people have been very focused, rightly so, on the challenges of our current healthcare system. It's expensive, it's fragmented, we got work to do, but it's also important to remember where we were before the Affordable Care Act, where people with pre-existing conditions couldn't get treatment, where people were afraid if they were on Medicaid and they did have benefits, they were afraid to go back to work. So I just think as important as it is for us to drill down on the challenges with the ACA and the things we need to do better, it's important to remember what the world without the ACA looked like and how devastating that was. Either you couldn't get treatment at all or you went bankrupt if you did, if you had a pre-existing condition. And I think maybe that, Ms. Keith, I will maybe just ask this one question of you, which really goes to this issue of what happens if we don't have health care coverage for everyone. Because one of the arguments that I hear is somehow that the ACA made healthcare more expensive. And maybe you could comment on the value of having more people covered, or in the optimal world, having everybody covered, people would have to opt out of coverage, let's say. But what is the value in terms of not only healthcare for people who need it, but also in terms of the expense of our healthcare system? Is there a positive value in having more people covered?
There undeniably is, absolutely. And with the enhanced premium tax credits in particular, the Affordable Care Act itself made huge, incredible gains in coverage, as we've discussed. But even the enhanced premium tax credits alone, bringing so many more people into the risk pool, has helped keep premium stable, which is what we're looking for. And so they've held actually steady and below the growth we've seen in the employer market, which is a really, really critical point. And so facing huge coverage losses, we would expect those premiums to go up over time, and the level of disruption that we're seeing here distracts, I think, from the really important points that you have made, that many other senators have made here, of what we're doing about the healthcare system and making some of the improvements that we need. Even the idea that we're talking about going to health savings accounts as a solution to this is not, we're going in the wrong direction. We know consumers want lower costs, better coverage, and less complexity, and it takes us exactly in the wrong direction.
And healthcare demand is generally not an elastic thing, right? Exactly. So it's not like a classic supply and demand issue. When your baby has an ear infection at 3 o'clock in the morning, you're not shopping around. And one last point, I guess, just to Senator Warner and my colleagues and to all of you. There has been a lot of bipartisan work in the United States Senate on healthcare costs, and I want whoever's watching this hearing to know that. Unfortunately, a lot of it, which was in an end-of-the-year package a year ago, PBM reform, a bunch of other stuff, it had passed both the House and the Senate, and we were ready to pass it again, and Elon Musk, in one tweet, essentially vetoed it. So we should bring back some of those good bipartisan pieces of work and continue to work on healthcare cost transparency and coverage and bringing down the cost for everybody. But thank you all for being here and for your expertise. And Senator Warner, thank you for holding the hearing.
Thank you, Senator Hassan.